I've helped over 1,000 people heal from hip arthritis, and the difference between those that did not have hip replacement surgery and those that did are these 14 rules for healing hip arthritis. It's possible to get your hip arthritis pain under control within 90 days so that you can heal for the long term. So let me get into the rules for you. Rule number one is don't freak out when you get the hip arthritis diagnosis. Most of the time when I'm talking to people that have been diagnosed with hip arthritis for the very first time, they just went to the doctor, they got the x-ray or maybe some other image, an MRI, something like that, and the doctor broke the news to them that they have hip osteoarthritis. And they'll usually grade it, grade 1, 2, 3, or 4, with 1 being the least severe and 4 being the worst. And usually about grade 2 and up is when doctors start to recommend having a hip replacement surgery. If it's grade 1 or 2, they say not now, you'll probably need one later. If it's grade 3 or 4, they might start talking about having one today, or I mean, not today, but here in the next month or so, very soon. They'll start scheduling you for it. Now, if you have a diagnosis like this, you probably leave the doctor's office freaking out. I have patients tell me that they left crying. They sat in the parking lot and cried. They were faced with their age. They were faced with the fact that the hip got this worse, this bad, and now they have to have a surgery, a major surgery for it. They have to go under, and maybe they got details about the surgery from the doctor. I don't want you to worry about any of that. What I want you to think about instead, this is a rule that I tell all the patients seeing me for hip arthritis so they can avoid surgery. I want you to think instead that it doesn't matter what the x-ray looks like. What matters most is what you can do, because it's 100% possible that you have the worst looking x-ray. Your hip looks disgusting on the x-ray. I mean, the surgeon might even raise their eyebrows and say, this is the worst hip I've seen in all this year, in the past 5 years, whatever it is. But if you can move your hip pretty well, if you can, maybe you're a little limited, but you can still move your hip around really good, you have like 90% or better of your other side, your good side, then chances are that you're going to recover just fine once you start doing the right things. You're not destined to have a hip replacement no matter what. There are things that you can do to manage your situation and calm down that hip arthritis and get back to doing the things that you love to do. Number 2 is, if you were told that you have bone-on-bone hip arthritis, you can still do everything. It doesn't matter. The reason why I say this, even though the doctors might make a big deal, they might say, they'll look at the x-ray, pretend this is your x-ray, and they'll say, look, if you can see right there, there's the ball and there's the socket, and the spacing there is almost gone, or it's touching even. And then they'll have a comparison on your other hip, and they'll say, look at the spacing there. It looks good. They always talk about joint spacing. And it's a good thing to talk about overall because it gives us an indication of what the cartilage health is like. But if you pair that information with your mobility, in other words, with how flexible you are, if you have 90%, like I said, motion or better in your bad hip compared to your good hip, then you have a shot at being just fine, even if the doctor says that it's bone-on-bone hip arthritis. Because what matters more than anything else is the potential to improve. And when there's no space left in the joint according to the x-ray, but you can still get around decently fine. Yeah, it hurts. I get that. Yeah, it's stiff in the mornings. I get that too. Those are fixable situations. But if your motion is good, then you have a lot to improve on. Now, if your motion's terrible, if your hip locks and you can only bring it up a certain amount, you've got like an 80% available motion compared to the other side, you've got a 50% loss of motion, then you might need a hip replacement. But those situations are far and few between. People don't typically get that bad before having a hip replacement anyway. So if you're here right now and you've got good motion, you still have a shot, even if it's bone on bone. Rule number 3 is that the root problem of hip osteoarthritis is a muscle imbalance. It's a pressure problem. They're related. Let me explain what this is. In the ball and socket joint of the hip, there's muscles all around it, and if we simplify this information, the front of the hip is the hip flexors and the back of the hip is the glutes, the hip extensors, or the butt muscles, in other words. When there's an imbalance between these two muscles, it changes the position of the ball within the socket. The alignment gets pulled forward towards the stronger muscle group, which is usually the hip flexors. And people that have hip arthritis, and if that's you right now, you're probably going to agree with me, you tend to lose your butt muscles. You tend to have not much back there. You tend to not feel those muscles work ever. The back of the hip, the glutes, and every patient I've seen with hip osteoarthritis have been very weak, while the front, the hip flexors, are very dominant. They work well. And so when you have that imbalance there, it pulls the ball forward on the socket, creating too much pressure in the joints in that front area. And that's typically where the arthritis is. That's ground zero for the arthritis. That's where the cartilage gets worn down. That's where other issues happen, like labrum tears too. You might have had a labrum tear leading up to your hip arthritis. There's other associated problems like hip bursitis, trochanteric bursitis. There's all kinds of issues, tendonitis in the hip, that are set up by the same root problem, and it's what explains why you've got hip arthritis. Not your age, not other factors. Yeah, maybe they play a small role, but you can't treat your age. You can't treat your genetics. You're born that way. What you can fix, though, is the position of the ball and socket, so that you can reduce the pressures inside that ball and socket joints and normalize them so you can allow it to heal. If you look at hip arthritis this way, then there's potential for you to improve it, and you're not just destined to eventually get a hip replacement. And when the doctor mentions that to you, when they say, well, yeah, you got hip arthritis, if you want to take care of it here in the next year, maybe you got 5 years if you're lucky. Don't believe that. You can affect this problem. You've got to fix the muscle imbalance though. Number 4 is you've got to avoid strengthening your hip flexors. Because of that same muscle imbalance that I just explained to you, those muscles on the front, the hip flexors, are dominant. And so if you do exercises to strengthen them, to use them more, then you're going to just feed into the imbalance. And if you're doing strengthening exercises for the whole hip, that's what often happens. They'll say, well, we're not just strengthening hip flexors, we're also strengthening the abductors or the glutes or the extensors, the other muscles in the hip. You're going to get everything stronger equally if you're doing what most people tell you to do, is strengthen everything, which means that if your hip flexors are stronger and everything else is weaker, that's what's causing the ball to shift in the socket and cause those bad pressures. And if you just work everything out, you're going to increase your strength overall this way, which is still an imbalance. And you're still going to be putting pressure right here. What we need to do is this. I would even say allow those hip flexors to become a little weaker while you gain more strength in the glutes so that you can center that ball in the socket. Consistently, when I do this with my people, with my patients, online, in person, however we see them, they get better, despite them having the worst hip arthritis that their doctor's ever seen. Number 5, avoid strengthening your quads. The quads are the muscles on the front of the thigh. The reason why is because one of those muscles, it's called the rectus femoris muscle. It's the one that's right in the middle, on the top, on the front of your thigh. It attaches to the tip of the kneecap right here, the very top of it, and then it comes up, crossing the hip joint, and it attaches to this area right here, on the front of this bone right here. Because it crosses the front of the hip joint, it's technically a hip flexor muscle. It can be used in hip flexion, which pulls the ball forward on the socket. The reason why I make such a big deal about this is because very often people that have hip arthritis also have knee problems, and strengthening the quads is bad for the knees. So it's just a double whammy when you strengthen those quads, because now you're going to make the hip worse, because the rectus femoris is a hip flexor, so it's pulling the ball forward in the socket, but now it's also adding bad compression forces to the knee joint. So you're just setting yourself up for a hip replacement and a knee replacement later on in life. So don't strengthen the quads. Just leave it out completely and focus on the glutes instead. Number 6 is get help from a walker or a cane. Now, the first time I mention this to my patients, especially if they haven't been using a cane or a walker, I get the sigh of discomfort. They go, oh. And they do this because they've been told, or they've had the thought already that I should be doing that, but they don't want to do it. But when you get on that cane, when you get on that walker, especially if you have pain when you're standing, I mean, think about this. If you go to stand up and immediately your hip hurts, that means that your hip arthritis is so flared up that just normal weight bearing is aggravating your hip joint. Now add movement on top of that. Now add changing directions. Walking straight is relatively easy, but when you have to change directions, if you lose your balance and have to catch it, it's going to aggravate your hip more. So you have to offload it. If you can lean some of your weight on a cane or on a walker ideally, because that's going to offload you a lot, then you can begin to walk and move and you get more time on your feet. Because if before your hip was hurting when you stand on it and you just can't tolerate it after 5-10 minutes, you have to sit down, you're just making the problem worse. You're keeping it irritated. You're going to aggravate the hip arthritis. The bony changes inside are going to get worse. You're getting yourself closer and closer each time you're on your feet to a hip replacement. But if you can offload it, now you're going to extend the amount of time that you feel good, that it doesn't hurt, and you're allowing some movement to happen. You're setting yourself up to heal from hip arthritis. So you have to get the hip unloaded by getting the walker out or the cane. And a big point of resistance that I get from patients is that they're afraid to get on the cane or the walker because they're gonna feel old, or they're gonna have to now explain themselves to their friends and family about why are you using the walker, why are you using the cane? And I get it, you just have to go through it. That's just part of it. But don't you want your hip better? Don't you want to avoid a hip replacement surgery? Because you're definitely going to be on a walker or a cane after the surgery. And very often you're never going to let it go after the surgery because you lose so much strength after the surgery. And so many people have problems after the surgery. They end up having even revision surgeries where they have to get a second hip replacement done because the first one didn't work out right. Sometimes right away, but more oftentimes later, like a year or 5 or 10 years later, they have to get the hip joint revised after they've replaced it the first time. So we don't want to even go down that route. If you just start using the walker or the cane now for a time, get stronger in the right muscles, calm down your hip arthritis, then you can eventually let go of the walker and let go of the cane and get back to just normally walking around the way that you like to. Number 7 is clearly understand regenerative medicine. When I say regenerative medicine, I'm talking about stem cells, PRP injections, platelet-rich plasma injections, hyaluronic acid injections. Those are the top 3. There's other ones out there. They are not solving the hip arthritis problem. They are assisting treatments to allow you to get more time on your hip, to allow you to be able to do more stuff without the hip being as bad. And what a lot of patients talk to me about whenever they've gotten stem cells or PRP or hyaluronic injections for their cartilage inside the hip, they're hoping that it's going to solve the problem. They think of it as a cure because often that's how regenerative medicine doctors are talking about this. They're saying this is going to replace the cartilage cells that you've worn out and lost or that you've killed off. But if you apply the muscle imbalance concept that I talk about all the time, where those muscles on the front are too strong and dominant, they're pulling the ball forward in the socket and they're compressing the joint. If that ball and socket joint is compressed and you inject stem cells in there, or you inject hyaluronic acid or PRP, whatever it is that you're doing in there, and the joint's still compressed and you never fix that part, your new stem cells that you're hoping turn into cartilage cells, or the cartilage cells that you're trying to heal with PRP or offload with the hyaluronic acid, they're going to be squashed and you're going to hurt them again because you never fixed the root problem, the muscle imbalance. So I'm not saying don't do it. I'm not saying don't talk to regenerative medicine doctors. I think they're doing some research and they're trying new things out, and it's going to be a growing field and there's going to be some cool advancements, already have been. But the root problem still needs to be addressed. So if you go get stem cells or PRP injections or any of these things, just realize that you can't rely on it alone. The worst thing is to get the injection and then wait. You still need to work on the muscle imbalance. Number 8 is don't rely on pain medications. I get patients all the time that come in and they pull out of their purse the bottle of Excedrin, the bottle of Aleve, whatever medication they've been taking. Sometimes it's prescription strength medication. And they have it with them just in case. And they're ready to pop a pill to take the edge off the pain. That's all it's doing. It's not solving the problem. It's just taking the edge off. And the reason why I think it's a terrible idea, besides it damaging your organs, your kidney, your liver, your other organs, your stomach for sure. It's giving you the wrong information because it's allowing you to continue doing activities that are aggravating for your hip arthritis because you feel less pain. So it's sending you the wrong information. It's teaching you wrong. It's teaching you to just grit through your day, doing things inappropriately, making your hip arthritis worse with a little less pain. It inevitably ends with hip arthritis getting worse no matter what. But people have that expectation too. They're thinking, well, it's an age-related condition, so it's just going to get worse no matter what. Might as well just take this pill so that I feel a little less pain here for the next month or two. Not a good idea. You need to go back and solve the root problem and only use these medications as a way to get through tough times. That's, I think, the better way to use it. Because I'm not saying never ever take pain medications. I'm not saying that. I think there's a right time and a right place and a right way to do it. And the way that I think you should do it is if you know you have to be on your feet and it's going to mess with your hip, it's going to leave you worse for the next day or two or week even, then it might be a good idea to take pain medication. But if it's a normal day and you can usually tolerate it just fine with your hip, then maybe don't take it that day. The other reason you might take it is if your relationships are getting bad because of the pain. Because let's face it, when you're in pain, you're grumpier. You're just not yourself. And if that's affecting your marriage, if that's affecting your relationship with your kids, with other loved ones around you, then maybe you take pain medication for a little bit so that you can feel better, put on some smiles for a time, and then get to a point where you can get off the pain medication and start working on the root problem. That's it though. You've got to go back to the root problem. It's not a quick fix, solving the root problem. It's a long-term fix, but it's something that needs to be in play as soon as possible. You have to start that process as soon as possible so that you're gradually relying on medications less and less. You're not worrying about other treatments that are just intended to be short-term, and those can fall by the wayside as you fix the real problem, the root problem. Number 9 is quit focus on stretching. And I'm not saying that stretching is always bad. All I'm saying is that I have patients I've seen, a good chunk of them, that tell me that they stretch on a consistent basis. And it can give you some improvement, but it's very short term. I'm not saying don't ever stretch. I'm just saying don't look at it as a way to solve your hip arthritis problem. Because the root problem is still the imbalance. And very often they're doing a hip flexor stretch because that's where they feel tight. They feel tightness in the front of the hip, and accurately so because those muscles are just dominant. They're always working. They're compensating because of the weakness behind here. And so the idea is to stretch your hip backwards in this direction. Maybe you come outwards too. And in the moments after you stretch, you usually feel better because the joint got a chance to move. Where you've had all that compression right here in the front because of the muscle imbalance, you finally loosened it up. But guess what? This muscle's still dominant and this muscle's still weak. And as you begin to go through your day, as you get back to your routine, you're going to reactivate this muscle a lot and pull that ball forward in the socket, and then the cycle continues. Stretching is not a long-term solution. It's a short-term solution. And I'm fine with you doing it every day if you wanted to, but I wouldn't emphasize it too much. I wouldn't spend more than a few minutes on it. I have people that come in and say, I stretch 30 minutes at the beginning of the day, 30 minutes in the middle of the day, again at the end of the day. And what tends to happen to these individuals is they increase their amount of time that they're stretching. They stretch more aggressively, and they don't get as much of a return on their stretch time. It doesn't help them as much as time goes on, and then they end up giving up on stretching. And some people take it to the extreme of going to like a yoga class to get stretching. And I'm not saying yoga's bad. I think yoga's an excellent thing, and if you want to pick up yoga, it's probably only going to help you overall. But if you're trying to pursue a stretching activity, especially if you're trying to get stretching out of yoga, it's not going to solve the root problem of your hip arthritis. You have got to get the glutes stronger. You've got to solve this muscle imbalance. You've got to get pressure off the inside of the hip joints. In the long term, that's what's going to resolve the issue for life so that you can be normal again later on. Number 10 is don't worry about your weight. Now, unless you're severely overweight, like morbidly obese, I'm talking about more than 70 pounds beyond the weight that you should be. Don't worry about your weight. If you're 20, 30, 40, 50, even 50 pounds overweight, chances are you can get stronger in the right way and make improvements in your hip joint. Because going back to the ball and socket here and the imbalance that happens, the ball moving forward, if you have an extra 50 pounds up here all over your body, it's not going to massively change the ability of you to strengthen the right muscles and pull the ball into the socket. The problem is when you're morbidly obese, when you're more than 100 pounds overweight, and there's a range. I usually tell people 50 to 100 pounds because it's different based on your body size. There's a lot of variables, but generally speaking, for sure, if you're 100 pounds overweight, you're going to need to focus on losing weight. But most people that I see, they've got 20, 30 pounds to lose, maybe a little bit more, maybe a little bit less. Have a lot of very thin people that need to gain weight that have severe osteoarthritis, and it's because of the muscle imbalance. So that's why I tell people you don't need to worry about losing weight most of the time. Focus instead on fixing the muscle imbalance, and you're going to get a much better use of your time that way. Number 11 is get stronger glutes. I've been talking about this as we've gone along, but I need to just make it a point here because you don't know how important it is for you to just be able to activate your glutes independently in order to solve your hip arthritis problem. I have so many patients that have been to physical therapists, they've worked with trainers, they've seen doctors, they've traveled to see physical therapists and doctors, and they don't get this information that I'm sharing with you right now. You've just got to activate your glutes. They've done all these exercises and never once thought, are my glutes working during the exercise? They've never been able to isolate glute contractions. Like just right now where you're sitting, put it to the test. Can you tighten up your butt muscles, your glutes, without everything else tightening up too? So if you just do it, sitting, standing, lying down, whatever position you're in, tighten up your glute muscles. What ideally you should be able to do in order to be successful for solving your hip arthritis problem is those glute muscles should tighten up back here behind the hips, and your thighs should be fine. They shouldn't be tightening up. Your back muscles should not be tightening up, and definitely not the hip flexors and anything on the front of your hips. None of those muscles should be tightening up. It should be your glutes. If you cannot do that, if you try to tighten your glutes and thigh muscles are tightening up, back muscles are tightening up, hip flexors are tightening up on the front of the hips, you've got the imbalance. And until you face solving this contraction problem, being able to get your glutes to work right, then you're not going to make improvements in your hip arthritis. Maybe you'll make temporary improvements because you're moving the joint around. That just feels good, especially if it's stiff. But you're still going to be dealing with the muscle imbalance, and the ball's going to be forward in the socket, and you're still going to be set up for worsening your hip arthritis as time goes on. So you've got to get the glutes activated, and then you've got to strengthen them. That's kind of step 2 of this one right here. Because activating them it takes a lot of effort for some people to just turn them on. You have no idea how many patients I see that we spend a month just practicing activating the glutes, not even strengthening, just tightening them up without everything else tightening on. Then after we go through that time, some people get it fast, but after we go through that part, then we go through strengthening the glutes. Now we have to do reps. We have to get them tired. We have to add weights eventually to the exercises that are strengthening the glutes. That's a whole other process. And related to this, kind of a bonus on this point, on this rule, is ab strengthening. You've got to get stronger abdominals, especially the lower abdominals, because if you don't get good strength from the lower abdominals, the glutes are at close to the same level as those lower abdominals, and so they help to stabilize these bones here so that your glutes can work properly. And if you don't have good abdominal strength, then there's a possibility that strengthening your glutes is not going to fully help. Now, as a bonus to this point, getting strong abdominals, especially the lower abdominals right here, is super important to give stability to these bones, to these pelvis bones, because if you don't have good stability here in these pelvis bones, then there's a chance that the glutes might not work optimally, the best that they can. Sometimes people run into problems where their glutes are coming along, they're getting stronger, and they're getting improvements overall in their hip arthritis, but then they hit a wall. They start to plateau in their improvements, and when we look at their abdominal strength and make sure that that comes up too, then they break through that wall and they stop plateauing and they continue to make improvements. Number 12 is quit walking for exercise. One of the first exercises that healthcare professionals love to give to people with hip arthritis is walking. If you go to a physical therapy clinic, they'll probably put you on a treadmill to have you walk. The doctor, the surgeon, if they're trying to not have surgery, they're trying other things before they go to surgery, they might say, get on a walking program. Start walking in the mornings. Get in 20 minutes, get in a mile or two. And what inevitably happens as you start your walking is it might feel better at first. It often does. The reason for it is because if you haven't done anything, if you haven't done much walking, if you've been kind of sedentary for the past months or years, which you've probably done because you've been in pain, then it kind of feels good to just get moving. But then after a time, it begins to make the hip arthritis worse. And the reason for that is because if you haven't figured out how to get your glutes active, then as you go walking, you push on the walking, like you're trying to walk farther or faster. You start to compensate with those hip flexors, which are already too dominant and strong, and it just worsens the position of the ball in the socket and aggravates the hip arthritis inside the joint. So I think walking should not be done if you're starting out on helping your hip heal from hip arthritis. You need to stop walking and you need to get to doing other exercises that fix the imbalance first so that you can come back to walking, and then it's going to be helpful for you rather than harmful. If you can do walking properly, using your glutes and not being hip flexor dominant, then it can become a good thing for you. But until then, if you can't get your glutes active, if you're sitting here on this video with me and you try the glute thing and your thigh muscles take over, you shouldn't be walking. You should not be walking. You need to instead be doing calm exercises, lying down, sitting down, not on your feet. Only walk what you need to for daily living, but don't go on a walk for exercise. It's a terrible idea. And the reason why they recommend this is because they see correlations in the research. Correlations just means that as this thing happens, this other thing also happens. But it does not mean that it causes it. That's a whole separate effect that we're talking about that is a higher level of research, and our research isn't there yet. Our research is not great in healing hip arthritis naturally. It's just not there. So as people walk more, they say that people tend to feel better in their hip arthritis. But if you also look at the research about how hip arthritis progresses, they tend to get hip replacement surgeries. So there comes a point where walking no longer feels better despite trying to do more walking. The hip arthritis gets worse, and then people end up having a hip replacement. 1 in 5 people get a hip replacement who have hip arthritis. So it's not a good idea to pursue walking as exercise. Number 13 is you've got to figure out how to walk properly. When you walk, you should be firing the glute on the foot that lands on the ground. So if you step with your right foot, as soon as your foot makes contact with the ground, the glute on that right side should tighten up subtly. It should just tighten up a little bit. And then as you step with your left leg, when your left foot contacts the ground, then the left glute should begin to tighten up, like 20%, maybe 50% at most. And then as you pick up your other leg, that glute relaxes, and then you have to eventually bring that leg forward, and then that glute contracts. And so walking is just alternating glute contractions. Now think about this. If you can't even get your glutes to fire, how are you going to get to consciously alternating glute contractions? It's possible, and you can do it. But if you can't currently do it, you've got to get your way up to doing that in order for walking to be productive for you. And people laugh whenever I have them in the clinic. They say, really, you want me to learn how to walk? I know I've been walking my whole life. And I tell them, yeah, because right now it's messing up your hip arthritis. Do you want to have the hip replacement? Then keep walking the way that you've been walking. You're walking yourself into a hip replacement surgery. But if you can get your glutes to independently contract at the right time during the walking cycles, then you're going to be able to have walking be helpful for you, and you'll be able to walk as much as you want. Sightsee on a vacation, walk for exercise, maybe even run one day if it's right for you. Keep up with the family, keep up with the grandkids. Not have to rely on a cane or a walker as you walk, because you can strengthen your glutes properly. You're going to be able to walk just fine, but you have to crack walking properly. Number 14 is it's not age as the cause of the hip arthritis problem. This is big. This is part of the self-limiting beliefs that I have to work on with my clients that I see here in person because they get fed by the medical profession at large, healthcare professionals. We're talking doctors, surgeons, physical therapists, any healthcare professional out there. They're regurgitating what they learned in school. And they're doing good by you. They're trying to help you out. The intent of just about every healthcare professional out there is to do good by you, to make sure that they treat you the best possible. Sure, there's a bad seed here and there, like in every profession, but for the most part, they are going to do the best they can for you. And they're telling you what they learned in school, which is hip arthritis is an age-related problem, which is wrong. It's not. It's a pressure problem. It's the ball badly aligned within the socket because the muscles are yanking it over that way. And you can make it better despite you getting older. How is it that I have patients coming in here, 70 plus years old, we go through 90 days of treatment, 3 months of treatment on average, some do less, some do more, it just depends on the severity of their hip arthritis, and they're 90 days older and they're better. It's not an age-related problem. It's a pressure problem because of the root muscle imbalance. You've got to take control of that. You've got to just tell yourself that that's what it is, despite you feeling crappy right now in your hip, despite you feeling stiff, painful, down in the dumps because you might have a hip replacement surgery. You've got to charge through forward and get that hip moving right. Don't walk. Don't go pursue hip flexor exercises. Don't get your quads stronger. Get those glutes stronger. Get those abdominals stronger. Take your time getting into walking properly. And despite your age, you're going to get better. Despite the severity of the hip arthritis, despite what the x-ray says, despite what the doctor told you that you're going to have to come in and get the hip replacement eventually, screw that. You can get better. Just go fix the root problem, and it's going to get better.